Patient case study number 30. So now we're dealing with a 24-year-old healthy male. He's been an active runner, healthy appetite. He's also a vegan until recently. So what you guys are going to notice is that you'll read through the rest of the scenario. You guys will summarize it in your own words and put that down the bottom as kind of like what the nurse practitioner, the technician, whatever your title wants to be in this particular activity, so that you guys are summarizing why that patient came in to see you. So what we're going to start out with is we're going to start out with the urine sample, and we want to look at color as well as clarity. So I've added that sample to the tube for you guys so that you guys can get a little better view of what that color would look like. Okay, that blue that you see coming off that's just reflecting from my glucose tubes off to the side. But there is my color, so give me a color that you have, and then clarity. Is it clear, or does it look to be a little cloudy to you? Does it have any turbidity, cloudiness, or you're not able to see through it? Okay, if you're not sure, go back and compare it to Mr. Rollins in your control video. So there's your color, there's your clarity, and now we want to look at pH. So down the bottom of this sheet, you guys are going to see two pH scales that are set up. The first one goes 0 to 14. The second one's going to be a little more exact for you, because remember, we can only go up to half numbers on here. This one can go every 0.2, 0.3, and help us measure just a little bit more accurately. So for patient number 30, I'm going to do the first type of pea hydrogen paper. I'm going to add a little urine to that particular strip. I'll zoom in on it in a moment, but you guys are going to match that color up as best you can. You can go half numbers if you like. And then there's my second sample, still number 30. So this is the urine for number 30 on both of them. There is my first one. You guys want to match that pH up to the strip. So there's the urine. Match it up where you need to. You can go half numbers. Right next to that, in the same column on your data chart, you guys want to include this one here. So now we're going to get a little bit more exact. You can see the measurements are a little bit better within this particular type of pea hydrogen paper. So put both of those pHs, hopefully they're kind of close to one another within that particular area on your data chart. Next up is our glucose test. So my first sample would be Mr. Rollins. His looked like that. I'm just kind of giving you guys something to compare it to. Urine was added to Benedict solution. Benedict solution in the urine was put on heat. And you can see after about 5 minutes, there was absolutely no change, so no glucose. So if we look at patient number 30, same thing. I added the urine, I added Benedict solution, I put it on heat to activate it, and this is what I get at the end. So fill in your results. I would also do a qualitative, so kind of put what color rather than just pluses and minuses within there. The next two tests that we have is going to be for protein as well as chlorides. So you can see I put Mr. Rollins across the top so you guys can kind of compare it. And then I put test patient number 30 along the bottom. Protein was in well number 1, so that was kind of like your 10 drops of urine and about 5 drops of urette solution, which tests for protein. Rollins was normal. He's our control patient. Look at patient number 30, however. We do have a change within that when I added burette and let it sit for about 3 to 5 minutes. So mark down what that change may represent. Next would be your chlorides. So I put them under or over top of black backgrounds, because if it was positive for chlorides, it would be kind of this cloudy white that you would see there. So Rollins is normal, and there's no cloudiness that we see here. I'll kind of slide it down so that you guys can see. There is absolutely no clear or cloudiness there. You can actually see through it, which may help you with your clarity as well. Okay, so that's what you guys have for patient number 30. What's left is that you guys need to go through, look at your microscopic view of the slide on Google Classroom, copy and paste that into your particular data chart, just like you did for Rollins, and then kind of come up with an analysis. Follow the sheet, follow the rubric on your little write-up to determine what this particular patient may have going on with them.